COPD, chronic obstructive pulmonary disease, is a progressive disease that makes it hard to breathe. Emphysema is a type of COPD. The Swiss physician Théophile Bonnet was the first to describe emphysema as a separate medical disease. Bonnet described the effects to be lungs larger in patients with emphysema, and he believed that this was the cause for shortness of breath. This disease cannot be cured, but there are treatments that can help relieve symptoms and slow the progression of this disease. A few notable women who had emphysema include ex-First Lady Pat Nixon and singer-songwriter Amy Winehouse.
Emphysema is a type of COPD, and this condition is affected primarily due to a history of cigarette smoking. Normal functioning lungs have bronchioles that branch out and end in small, numerous sacs called alveoli, and the protein elastin of the alveoli maintains the structure and shape of the alveoli during gas exchange. Trauma, like smoking cigarettes, damage these alveoli walls, which result in the loss of shape and structure of the air sacs. This ultimately causes the air sacs to be fewer and larger in size. Because air sacs are responsible for transporting oxygen to the rest of the body while removing carbon dioxide, the damage can lead to a reduction in the amount of gas exchange. The pollutants from the smoke can also deteriorate or weaken the walls between each air sac as well. Because surface area is lost, lack of oxygen intake and lack of carbon dioxide output will cause the individual to experience difficulty breathing, and hypoxemic or low levels of blood oxygen conditions will occur. The conditions of emphysema have been extensively researched through autopsies of non-smokers and smokers. In a study called Emphysema and Lung Macrosections Correlated with Smoking Habits, which was performed by A.E. Anderson, the relationship between pulmonary emphysema and cigarette smokers were researched through extensive exploration of 71 autopsies, both of those were smokers and non-smokers. This research, like many other research involving prevalence of emphysema in autopsies, have found that smoking is one of the major causes of pulmonary emphysema. According to the Lung Institute, although long-term exposure to air pollutants like tobacco smoke, air pollution, chemical fumes, and manufacturing fumes is the main cause to emphysema, other factors like genetics and inherited protein deficiency can be a factor for emphysema development. The National Emphysema Foundation and Lung Institute have found that an estimated 3.1 million Americans have been diagnosed with emphysema, and the emphysema deaths per 100,000 population is 2.6. Though the numbers of deaths are not very high, emphysema is a part of COPD, and COPD is the third leading cause of death in the United States. This shows that the average person who is exposed chronically to air pollutants and or has family history of emphysema and COPD should be concerned and have knowledge of preventative measures and lifestyle changes to reduce their risk of getting COPD and or emphysema.
There are two groupings of symptoms within COPDs. One is called pink puffer, which is more specific to emphysema as opposed to chronic bronchitis, which is another COPD. Pink puffers experience dyspnea, which is difficult or labored breathing. They may also experience tachypnea, which is abnormal rapid breathing. They also may have a barrel chest or a widening of the chest. Whereas the symptom pattern of blue bloaters, which is more so specific to chronic bronchitis, includes symptoms such as sputum production or a regurgitation of saliva and mucus, along with chronic cough. Then there's hypoxia, which is an oxygen deficiency that may lead to cyanosis, hence the name blue bloaters. And finally, bronchi, which are continuous low-pitched lung sounds that resemble the sound of snoring or wheezing. Since both diseases, emphysema and chronic bronchitis, are often diagnosed at the same time, the two symptom patterns tend to overlap. Preventing emphysema can start with combating against the sole causes, smoking and air pollution. Therefore, the best ways to avoid emphysema should be reducing risky inhalational factors by not smoking, as well as improving the air quality of both indoors and outdoors. There is no known cure to emphysema, but there are ways to alleviate the constant discomfort, such as routine inhaled bronchodilators and corticosteroids. Bronchodilators such as beta-2 agonists, salmeterol and ipratropium temporarily alleviate dyspnea by preventing phosphorylation of ATP on the myosin chain, as well as activation of the sodium-calcium exchange pump. This results in a fall in intracellular calcium and leads to smooth muscle relaxation in the respiratory tract from trachea to terminal bronchiole, making it easier to breathe. Corticosteroids may also be used in order to reduce the inflammation, which will also aid with breathing. When a patient is in acute respiratory distress, they will most commonly be carefully given oxygen by using the minimum intake of oxygen needed to relieve the hypoxia of the patient. Because of the severe damage done onto the alveolar, epithelial, and endothelial cells of the lungs, the ability to repair them surgically is vastly limited. However, in some severe cases, a surgical treatment that allows the remaining lung tissue of the patient to expand, called lung volume reduction surgery, must be operated. The European Respiratory Society study on COPD conducted a 3-year study on 1,277 smokers diagnosed with emphysema. Patients were given budesonide, a corticosteroid, and within 6 months showed a slowing of the progression of the disease. The Medical Research Council randomized a controlled oxygen therapy trial designed to test the comparison between the use of supplemental oxygen for 15 hours a day to no supplemental oxygen, which conferred a survival advantage of over 3 years. At the end of the trial, the 87 subjects that participated showed that the supplemental oxygen therapy improved the rate of survival, 55% versus 33% in control group. Lung volume reduction surgery removes approximately 20 to 35% of the poorly functioning, space-occupying lung tissue from each lung. By reducing the lung size, the remaining lung and surrounding intercostals and diaphragm muscles are able to work more efficiently, which makes it easier to breathe. This surgery does not prolong life, but it can allow the patient to live a better quality of life.
Emphysema is characterized by a permanent enlargement of the alveoli and destruction of the alveolar walls from exposure to smoking and air pollutants, or inherited protein deficiency. Although it is not curable, there are preventatives and treatments that relieve symptoms and slow the progression of this disease. According to the Centers for Disease Control and Prevention, the known number of emphysema-related cases in the United States staggers over 3.4 million. The Lung Institute states that prolonged exposure to tobacco smoke, air pollution, chemical and manufacturing fumes cause emphysema. The best preventative, therefore, is to limit prolonged exposure to these contaminated air sources. Unfortunately for the 3.4 million Americans that do have emphysema, the damage done to their alveoli is permanent. It cannot be reversed. However, bronchodilator, oxygen therapy, corticosteroids, and lobar reduction surgery can alleviate some of the discomfort that accompanies emphysema.
Can't be on our own without you. I'm a little bit lost without you. Without you, hold me close when it's over. Life goes slow, love and sober.